We are Boston's new home for classic and hip hop. Urban Heat 98.1 FM and 1410 AM. The views, thoughts, and opinions expressed on this show are those of the host, guests, and callers and are not necessarily those of WZBR, its management, affiliates, and advertisers. WZBR and the Urban Heat holds no responsibility for the validity and/or accuracy of information on this show.
Hi, I'm drkerryann, and I understand the importance of Black mental health. That's why I decided to start my own show on the Urban Heat, Black Mental Health Matters. Join me on Sundays at 1 p.m., where we will discuss interesting topics and meet experts in Black mental health. Let's talk about the mental health issues facing our community. Listen online at heat981fm.com or download the app 98.1 FM, the Urban Heat. See you then.
Hello, everyone, and welcome back to Black Mental Health Matters. I'm Dr. Carrie-Ann Williams, and I'm a psychiatrist practicing right here in Massachusetts. And this is a talk show that's about all things related to mental wellness in the Black community. So if you have any questions or comments throughout the show, just give us a call at 617-238-7111. We're also currently streaming live on Facebook on the page for 98.1 FM, the Urban Heat. So you can go to the live stream and you can watch me there. You can drop a comment or a question throughout the show and I'll be able to see that. Throughout the week, you can add me on Instagram and Facebook at Dr. Carrie-Ann. That's Drkerryann. So glad to have you guys on the show, listening to the show today. And today I'm going to be doing my 2020 year in review. 2020 year in review. Guys, it's been quite a year. Of course, this is the first year that I've had this radio show. The first show of Black Mental Health Matters aired on March 1st of this year. And so this is about the 44th show to date. This year I've had guests from Massachusetts, Maryland, Arizona, and California. My guests this year have been psychiatrists, psychologists, social workers, and licensed mental health counselors. Oh, and also a pastor. We've had a variety of graduate level students from the Black Mental Health Graduate Academy at William James College. We've had psychiatry residents from Cambridge Health Alliance and Boston Medical Center, both programs at the Harvard Medical School. And we've heard about mental health services in our area, like Children's Services of Roxbury and Osiris Group, also in Roxbury, and Parenting Journey in Somerville. We've also covered a variety of topics: depression, anxiety, bipolar disorder, schizophrenia, trauma. Guys, what would you like to hear about in 2021? Let me know what you want to hear me talking about in the new year. Just drop me a comment on Facebook, 98.1 FM, The Urban Heat, or give us a call, 617-238-7111. So as I said, I'm doing my show today. It's my 2020 year in review. I'm so grateful that we've made it through 2020 and that I have this show. And so I'm going to be going through my top 15, my recap of my top 15 discussions for the year, some of my favorites. And just to give you an idea, especially for some of the listeners that might be newer, about just the variety of things that I've spoken about this year and guests that we've had. So this list is not in any particular order. It's not a countdown. It's just my top 15. So starting off at number 1 is depression. Depression was actually the topic that I used to kick off my first ever show on March 1st. Guys, depression in African Americans is twice compared to white Americans. Black Americans tend to have lower access to services and to receive a kind of poorer quality services. And depression in Black Americans, it matters. It matters, especially if it's not treated, because it can lead to a higher utilization of healthcare services, including emergency room visits. Untreated depression leads to absenteeism from work. So this feeling of needing to take mental health days can occur if you have untreated depression. And also what we call occupational impairment. So basically, even if you are making it to work, you may not be as productive as you could be. You may not be doing the best work you can be doing. You could end up with some poor performance reviews, and it could perpetuate this idea that, oh, the Black employee is not kind of working up to scratch compared to other people. And it may actually be untreated depression or untreated mental health issues. So really important to have that assessed and treated. The CDC reports that the third leading cause of death in Black men aged 1 to 19 is suicide, okay? The third leading cause of death in young Black men aged 1 to 19 is suicide. Of course, number 1 is homicide. Number 3 is suicide. So, you know, either being killed by others or, you know, dying by suicide. So this is actually really an important thing to talk about. I also wanted to just mention, you know, this idea that there's this higher utilization of like emergency room services. I've said this on the show, is that a lot of times in our community, we have a tendency to wait until things get to such a bad state that there's no other option but to seek treatment. And when that happens, we have a higher utilization of emergency room services and inpatient hospital services. What I would like to see us doing in our community is starting to find that intervention earlier, when things are mild to moderate. Because when you're able to seek services earlier, you have more control over your healthcare. When you wait until it's too late, then you just have to see the first person available, because things are so severe, you can't wait. You just have to see whoever has the first opening. But when you have, when things are mild to moderate, you can actually wait a little bit and say, you know, I don't want to work with this provider. I'd rather wait for this other provider. You can say, you know, I'd like to wait until I find a provider that meets the specifications I'm looking for. You have more control. You don't have to kind of say yes to everything, because you know, things aren't that bad yet. So I would encourage you to try to kind of seek services early. So that's number 1. That's depression. So number 2 in my top 15 recap of 2020 is anxiety. Anxiety was, I think, probably my 3rd show of the year. And, you know, the recap for anxiety is that anxiety is basically the body's alarm system, okay? So it has these 3 parts: the thoughts and your feelings and your actions. Thoughts, feelings, and actions. Anxiety always asks this question: what if? What if? What if the thing that I fear actually happens? It's always something negative. What if this negative thing happens? And the problem is not the concern that something bad could happen. The problem is when you can't turn the worries off. Like, it starts to become difficult to control. Your body is just not at rest. And so here are some signs that you may have anxious tension. Frequent headaches. Do you have frequent headaches? Because that could be due to anxious tension. It may be that the muscles at the back of your neck are tensed up. That can lead to headaches. What about frequent stomach problems? Sometimes that's because your body's not at rest. Your abdominal muscles may be feeling kind of tight, and that can lead to stomach problems as well. What about restlessness? If you're wringing your hands a lot, or tapping your leg, or kind of chewing on your pen, that's a sign that your body's not at rest. You may be dealing with anxious tension. So these are some of the things. And anxiety tends to go along with other issues. So it can run along with depression. If people are depressed, they often also have anxiety. Kids that have ADHD also tend to also have anxiety as well. And there are 2 main ways that we approach anxiety. One way is to focus on reduction of anxiety, and that's pretty straightforward. You know, you can try to take a break, get some exercise, spend time with your family and friends, go on vacation, get a hobby. These are all things that are focused on reducing your anxiety level. But the other way of trying to deal with anxiety is takes a little bit more work. And that is, you can try to increase your ability to tolerate anxiety. You increase your capacity to handle the feeling of anxiety. That requires more work, but it's actually probably the best strategy of the 2. So it's difficult because increasing your capacity to tolerate anxiety means you have to allow yourself to feel it. You have to actually face your fear, right? So if you're going to face your fear, like if you have social anxiety, you have to actually face your fear. You have to go to that party if we're not in a global pandemic. You can call that person or meet with that person. You have to actually face your social fears to overcome it. If you have a fear of something specific, for example, you have a fear of dogs, you will need to slowly expose yourself to dogs to kind of desensitize. Now, you don't want to flood yourself by, you're not ready for that dog to kind of jump all over you. That would be flooding. But you'd want to slowly expose yourself to situations where you might be in proximity to a dog. And by doing that over and over, you desensitize, or you increase your kind of capacity to manage the anxiety related to it. So sometimes it leads to a reduction in anxiety naturally, but sometimes the anxiety doesn't really reduce all that much. It's just that you now are able to handle it. You're able to do it afraid, so to speak. The other thing that increases our capacity to handle anxiety is mindfulness. Mindfulness. A lot of times when we think of mindfulness, we imagine that it's kind of like this meditation where we're just kind of clearing our mind and meditating and kind of chanting a saying or something. But mindfulness is actually focusing your mind. So you're focusing your mind on the present, trying not to kind of really focus on the past or the future, but focusing on the present. And specifically, for anxiety, you're kind of focusing internally on the particular sensations that anxiety brings up for you. So for example, you're focusing in on how your muscles feel. Are they feeling kind of tense? Where does it feel tense? You're focusing in on how does it feel for the air to be moving in and out of your lungs? How does it feel, with your lungs going up and down? Like, how do those sensations feel of anxiety in your body? And by focusing in on just the anxious feelings, stripping away all the judgment, stripping away all the meaning behind it, just focusing on the feeling, and doing that over and over, practicing that over and over, you can actually increase your capacity to tolerate the feelings of anxiety in your body. And that is one powerful strategy for increasing your capacity to handle anxiety. And there's a lot of emotions that goes for. Mindfulness can help with a lot of things, but anxiety is one of the things that it helps with. So that idea of just do it afraid is something that a lot of successful people do. They don't wait for anxiety to subside. They find a way to do it even kind of despite having the fear. And they may use some anxiety reduction strategies, but really overall, they just forge ahead despite being anxious. And when they do that day after day, it increases their capacity to tolerate and manage anxiety. And then for all the intellectuals out there, there is something called cognitive restructuring. Cognitive restructuring. And that is basically just trying to reason or rationalize for why you don't need to be so anxious. So you basically try to find evidence that the worst case scenario is very unlikely. So you're like, what's the evidence that this is going to happen? So for example, if you have test anxiety, you would rationalize and kind of say, wait a second, I'm really worried about whether or not I'm going to pass this test. But here's the evidence. The evidence is that A, I've been studying and I've actually been preparing for this. And B, I've taken so many other tests in the past and I've actually done okay on most of them. The evidence actually suggests that I'm more likely to pass this exam than I am to fail it based on my track record. So this is kind of reasoning and rationalizing and basically doing this cognitive restructuring. Or for example, if you're afraid to perform on stage, you would then reason with yourself and say, what's the evidence here? The evidence is, again, I've prepared and I've practiced. I've probably performed on stage before. Even if I haven't, if the worst case scenario did happen, if I slipped and fell, or if I made a mistake, could I handle that? If the answer is yes, then you can still do it. Okay, and that's also kind of a good strategy sometimes, is to ask yourself, if the worst case scenario happened, could I handle it? And this kind of strategy of using kind of intellectual reasoning, this is what a lot of folks use when they're trying to help calm your anxiety down, is that they say those things to you, don't they? They say, oh, don't worry about it because you've worked really hard, you've practiced, you've done this before. They're basically trying to help you to do cognitive restructuring. You didn't know, but now you know. So that's number 2, guys, anxiety. We talked about that this year. So number 3 on my top 15 recaps for 2020. This year we spoke about mental health disparities. Mental health disparities, guys. And I, you know, wanted to kind of recap some of these things. Compared with white Americans, African Americans are more likely to use emergency rooms or primary care, right? I had mentioned the emergency room thing earlier, but primary care is the other thing. We're more likely to use primary care rather than using a mental health specialist. So we want the primary care doctor to address the mental health concerns. And so what we do is we kind of cheat ourselves of actually meeting with a specialist who could provide better care for our mental health concerns, because we don't want to be seen going to a psychiatrist or a psychologist. So we sometimes lean on a primary care doctor to do it, but they're actually not the specialist in it. And so the encouragement is you need to go see the specialist, guys, right? Earlier in the year, Melissa Dagger and Tamara Leroy London came on the show, and they spoke about what therapy really is and why it can be helpful. It's really important to see a specialist, guys. There's a lot of really good reasons. So go back and listen to that show. Black people with mental health conditions, such as schizophrenia, bipolar disorder, psychotic disorders, they're actually more likely to be incarcerated than people of other races. So what we have is our prisons are kind of filling up with Black men and women who have untreated mental health conditions that have been addressed with legal consequences rather than mental health treatment. Patient-physician communication also is different between African Americans and white individuals. And one study found that physicians were 23% more verbally dominant. So they're talking over you, right? And they were also engaged in 33% less patient-centered communication with African American patients than white patients. So they're kind of talking around you. They're making decisions about you, but they're not really making decisions with you. This is something that is a common characteristic of kind of like a dominant group mindset. The dominant group doesn't realize they're doing it. They kind of verbally dominate, or they make decisions around you and not with you. This is something that happens to Black patients in the healthcare system. So we learned that representation matters. Representation matters, guys. It makes a difference if your provider is a Black provider. But there are so few of us. There's not very many of us at all. There's so few Black mental health providers. And so we're pulled, the few of us that are there, we're pulled in so many different directions. A lot of us don't even have openings anymore to see patients. Some of us are actually reducing the size of our practice because there's just so much going on. And earlier in the year, we had Dr. Charmaine Jackman on the show. And she is the CEO and founder of InnoPsych.com. InnoPsych is a directory of therapists of color. So if you're looking for a therapist of color and you want to find a directory, check out InnoPsych, INNOPSYCH, InnoPsych.com. Dr. Jackman also mentioned that mental health should be considered an investment in yourself, okay? Which is quite a shift from how a lot of us in our community think about it. It's an investment in your healthcare. In July, Brianna Reed and Lisa Saunders from the Black Mental Health Graduate Academy at William James College, they spoke about this idea of code switching. And you guys know what code switching is, right? And when you're in a therapy space, you shouldn't have to feel like you have to code switch, okay? You shouldn't feel like you need to change something about yourself in order to have to deal with a dominant group dynamic, or kind of, you know, this idea of your place in society and how you're being perceived. You shouldn't have to deal with all of that. You should be able to bring your true, authentic self with you to therapy. But as it is, we're, again, Black providers are few in number, so chances are you're going to end up with a provider that's not Black. But these are just some of the reasons why representation matters and why we need to increase the number of Black providers out there. But, you know, also, even if your provider is Black, what does that really mean? Because does being Black automatically mean that you have an understanding of that client's experience? Not necessarily. And Lanisha Allen and Tia Rivera, also from the Academy, brought up this idea of colorism, which, we don't talk about a lot in the US. We talk about it, I think, we talk about colorism a lot in like Caribbean cultures and places like that. But colorism, it can also come into the therapy space. Because what if you have a light-skinned Black doctor and the patient is kind of a darker-skinned Black patient? Is there kind of a dynamic that now enters the therapy space at all, right? So that's for you to kind of think about. But they brought that up as food for thought. Particularly because some individuals, they get certain messages throughout their life about what it means to be a darker skinned Black person. And in the interest of kind of like the whole like caste kind of your place in society, we've known that historically lighter skinned Blacks have a slightly different treatment historically than darker skinned Blacks. And so that can enter the therapy space as well. So these are all kind of these historical issues that enter into therapy. And a lot of times, white physicians don't even know that that's happening. And so it's really important to discuss these issues on the air, to talk about them in shows, and to, think about, what are your feelings and thoughts about that. So, we also spoke specifically about Haitian mental health. We had Giscard Saintil on the show in November. And so that was a great show. You guys ought to listen to that again. And let me know, in 2021, do you want me to have more shows that are geared towards specific cultures, maybe specific, countries in the Caribbean or in Africa or in different places? Let me know if you have an interest in shows like that. And if you have any suggestions for people that might be willing to talk about their experience as a mental health provider working with individuals of that culture, because I think it adds a nice flavor. Also, in the topic of mental health disparities, we had Dr. Andrew Austin and Dr. Gabriel Felix, who are both psychiatric resident physicians at Cambridge Health Alliance, and they spoke about representation from the perspective of the Black male physician. And I was so glad to have them on the show, because Black male physicians are probably the most underrepresented group of all. Guys, the enrollment of Black males in medical school has not gone up since 1978. The enrollment of Black males in medical school has not gone up since 1978. Now, if you're just tuning in, you're listening to Black Mental Health Matters. I'm Dr. Drkerryann Williams. I'm a psychiatrist here in Massachusetts. And today I'm having my recap show. It's my top 15 discussions of the year in review. And so if you have a favorite topic, or you have a suggestion for a future topic, if you have a question or a comment, just drop a comment on the Facebook stream. I'm streaming live on 98.1 FM, The Urban Heat on Facebook. And you can also call in at 617-238-7111. That's 617-238-7111. Hello to our listeners on Facebook, Joshua, Tamara. Thank you so much for joining us. So coming up at number 4. Number 4 is, this year I spoke about getting through the mental health effects of the coronavirus pandemic. Getting through the mental health effects of the coronavirus pandemic. I did speak about that this year. And I spoke about how to help kids get through the changes related to the coronavirus. And I reviewed recommendations from the CDC and elsewhere. So, just a recap about that is to remain calm and reassuring when you're talking to kids about the pandemic. But don't fake having a lack of reaction to what's going on. You can be honest with them that it is, in fact, a difficult time for everybody, but that we can be hopeful. We can be hopeful because there are things that we can do to try to keep ourselves as safe as possible. So we're not, it's a difficult time, but there's still things that we can do. So kind of balancing that anxiety with hope. Also, make yourselves available to listen and to talk with your children. Try to know, what is it that they know about the pandemic? What is it that they know about the virus? And correct misconceptions. The other thing is to pay attention to what kids are seeing on TV, what they're hearing on the radio, what they're, exposed to online. because that could be causing additional anxiety. And then teach them easy ways to practice good hygiene. Okay. Guys, a CDC study this summer said that 40% of US adults reported struggling with some emotional effects of the pandemic. 40%. And it's probably higher at this point because this was from the summer. So it's probably higher now that the numbers have gone up. But most often, the emotional struggle was depression or anxiety or reaching for substances to kind of self-medicate. Now, of that 40% of US adults, about 11% of those had said that they had seriously considered suicide. So this is really important, guys. You need to reach out and help people that you see struggling. If you know someone who doesn't have anybody, call, keep up with them, okay? Some of the signs of the stress of the pandemic are changes in sleep, changes in your eating patterns, irritability, worsening of medical conditions. And also pay attention to, are you drinking more? Are you smoking more? You know, these are some of the things that indicate stress. Now, during this time of stress, just recapping, you need to lean deeper into your faith, but also examine your thoughts, examine your thought life. Are your thoughts actually causing you to be more stressed out? So are you catastrophizing? Also, let go of your expectations of normal. I think sometimes there's a lot of talk about, well, you know, the pandemic is going to be over and then we're going to go back to normal. You know, things are not really ever going to be the way they were before. This has changed the world. So let go of your expectations of normal and kind of move forward to look at what the world holds for you next versus trying to get back to normal. Also, reach out and help someone else. It helps to take the focus off of yourself to kind of focus on someone else for a little bit, okay? Then be prepared. Make a plan for what you would do if you got sick. Sometimes so much anxiety happens because whenever there's a potential exposure, people panic and think, oh, what should I do now? What should I do now? And it's because there was never a plan. So if you make a plan, then it helps to reduce anxiety because now you can take action rather than fretting. Okay? Get your information from reputable sources. So what that means is if there is, you know, some video that's being passed around on WhatsApp, that is not a reputable source, okay? You need to get your information from reputable sources rather than from rumors. You make your decisions based on fact and not based on rumor. And that's one of the things that I've really hoped to be able to do with this show is that I can't tell you what to do, but what I can do is present information to you that can help you to make informed decisions about what you want to do with your life. So that you're not hearing rumors from other people, you're not even sure where they're getting their information from, okay? So get your information from reputable sources, and then take small breaks throughout the day, kind of blow off steam, and try to maintain a routine. That's probably been one of the most challenging things this year. I remember reading in the Boston Business Journal, they had, you know, the top CFOs of the year in Massachusetts, like the top 40, and I was reading through their different profiles, and you know, for a lot of them, they asked them, what's your morning routine? And several of them talked about how their routine has been disrupted by the pandemic, and some of them have never really regained that routine. And these are some of the most successful people in the state that are like in the C-suite, you know. So maintaining a routine is really important, but it's really been a challenge this year. So yes, that's number 4 on my top 15 recap of my topics of the year. And number 5 is trauma. Trauma. Big topic. I'll definitely be talking about this more in the future. Let me tell you, I'm looking at a comment here on Facebook from Paulette, and it says, simply being Black is a risk factor for mental health diagnoses. And it's like she was reading my mind, because that's exactly what I was going to say is just being Black in America can be a trauma risk factor in the US. Just, you know, racism, systemic barriers, treatment by the healthcare system. Earlier this year, I had Dr. Nicole Christian Brathwaite on the show, and she spoke about a study called ACE study. And that study connected current chronic health problems in adults, things like diabetes, weight problems, and heart disease. And it found this really strong correlation with the presence of childhood trauma. So this is actually one major explanation for the chronic health problems that Black Americans face in this country, right? Because here's the thing, traumatic stress, like the kind of stress brought on by racism, can literally change the way that the body works because it's putting stress on our biological systems, okay? And in fact, studies show that traumatic stress, like the kind of stress that's caused by racism, can literally influence our DNA, our own genetic code. And what that means is that if something influences our genetic code, we can pass it down to other generations through our DNA, right? So this idea that's, you know, sometimes people in healthcare think of race as this like independent risk factor that, oh, you know, Black people tend to have heart disease and weight problems and blah, blah, blah. And it's like, actually, the factor here is not race, it is racism, right? It's not race, it's systemic racism that's actually the factor here. That's what needs to change. Race is not the reason for healthcare, for health problems. So I think that's a teaching that needs to really kind of change. Okay, so basically, the systemic racism caused by that causes traumatic stress, that can affect the physiology of an entire race of people, and that leads to a disproportionately higher kind of rate of illness here. Okay, so that's number 5 on my top 15 recap. Coming in at number 6, child behaviors at school. Child behaviors at school. Early on in the year, I had Dr. Matthew Birmingham on, and we talked about child behaviors at school. Guys, Black students are 3 times more likely than white students to be suspended. And in preschool, Black children are 3.6 times more likely to be suspended. And yes, I did say the word preschool and suspended in the same sentence, which is alarming, because what are you really teaching a preschool child by suspending them from school? Okay, so that needs to change. But that's the school system in the US for you, okay? Black students make up about 16% of enrolled students in school, but make up about 25% of all students who are referred to the police. Then, of students who have disabilities, and this can be emotional disabilities, so you may have like ADHD or an anxiety disorder or some other emotional disability that really affects, that leads to you maybe needing special school services or that sort of thing. So of students with disabilities, about 19% of them are Black, about 90% of them are Black. But even though the Black children are just about 19% of the population in school with a disability, they make up more than a third, so 33% or more, of students who are restrained at school through the use of a mechanical device or some other equipment designed to restrict their freedom of movement. So again, there's this issue of people trying to kind of subdue and control Black bodies, kind of feeling more threatened by them. I also kind of spoke on the show about how important it is for Black parents to develop a working relationship with their child's teacher and their school team. And I'm not talking about, you know, barreling in there with kind of being forceful or aggressive or angry. I'm just talking about just communicate regularly. Be present, be visible, or check in by email. Just do friendly check-ins frequently so that the teacher and the school, when they see your child is not just another Black child in the classroom. They're the child of so-and-so. They know the parent, they've been communicating with you, and you know what's going on. You've been keeping tabs on things. I find that children, because I've been working with children for a long time now, and the children who have advocates, they fare so much better in the school system. Advocacy is everything. And again, you don't have to be loud, but if you're a fierce advocate, you are 100% better off. Your child is 100% better off in school if you're present and involved, okay? So that's number 6, child behaviors at school. Coming in at my number 7 out of my 15 for the recap of 2020, ADHD in children. ADHD in children. So ADHD, attention deficit hyperactivity disorder. Guys, it is biological. Biological. Now, many times people think when they see that children are having trouble with attention, they think, oh, they're just not trying hard enough. How come people in these other countries aren't being diagnosed with ADHD at the same rate? So this ADHD thing is just American. Guys, if a child has ADHD and they're not paying attention, it's not because they're not trying hard enough. In fact, the opposite is true. They're trying really, really hard, and it's just they're having a hard time with it. The other thing is sometimes people think that when kids have that impulsivity or hyperactivity that's caused by ADHD, they sometimes blame the parents and they think, oh, they're just not strict enough. They're not a good enough disciplinarian. They need to get their child under control. And it's not necessarily the parents' fault. Sometimes the parents are doing everything they can, but you have a child that has ADHD, it's a biological issue, and it's not because the parents are not strict enough. Okay, so with ADHD, there are a lot of things that you can do to be helpful, to try to compensate for some of the things. Disorganization is part of ADHD, forgetfulness is part of ADHD. These are kids that just can't keep it together sometimes. And you can help them in a lot of ways and use strategies to help them with that. But really, that can only take you so far. When something is biological, sometimes you just actually need to take a medication for it. And ADHD is one of those things. It's actually one of the simpler things that we treat as a specialist. It's one of the simpler things that I treat as a specialist. Because there's such a dramatic improvement. When kids actually have a correct diagnosis of ADHD, it's a dramatic improvement when they take the medication. But the key word is correct diagnosis. So inattention just by itself is not a diagnosis. Inattention is a symptom, and it can be caused by a lot of different things. Impulsivity and hyperactivity, that's not a diagnosis. That's just a symptom. A lot of things can cause children to be impulsive and hyperactive. So that's why it's really important to actually see that specialist, to see the child psychiatrist who knows how to differentiate all the causes of inattention and impulsivity and can narrow it down to ADHD. Now, a primary care doctor can also diagnose ADHD, and they're trained to diagnose and treat it. But you also have the choice to say, I would like to have my child see a specialist to make sure that it's a correct diagnosis before I, agree to medication. You can do that, okay? By the way, I'm going to get in my soapbox again and say this idea of ADHD being biological is yet another reason why spanking is unhelpful. You can't spank the ADHD out of a kid. Spanking doesn't address the biology. In fact, you're just going to end up demoralizing this child because they're going to be trying so hard to be attentive and be good, but because they actually have what they call an impulse control disorder, they literally can't slow themselves down. You're going to be kind of expecting the impossible, really. And it's going to lead to them starting to feel anxious and depressed and start to feel really bad about themselves and actually perform worse. So you have to be really careful with that. Now, at school, children with ADHD can get a 504 accommodations plan. They can get a 504 accommodations plan, and that usually comes by a written request from the parent. So you have to actually put a written request into the school to ask for that 504 accommodations plan. You can get a letter of support from your child's physician. I've written those kinds of letters from time to time when I worked with kids in high schools. And some of the things that you can ask for in an accommodations plan are things like time and a half for exams, doing exams in a separate room with less distractions, extra time for completion of assignments, things like that. So that's a 504 accommodations plan. So that's number 7. Number 8 is psychiatric medications. Psychiatric medications. Guys, in our community, we have mixed feelings. We have mixed feelings about psychiatric medication. Some people feel that medication makes things worse. And really though, what I see, the scenario I see often is what I kind of mentioned earlier, is that people wait until things are so severe that when they're that severe and you add medication, it can feel like the medications are not doing anything. And so someone who kind of walks into that situation from the outside, they kind of see this really bad picture where they see their friend or relative who seems to be struggling with a severe mental health condition, and then they see them taking like a handful of medications every morning, and then they kind of make this connection that somehow the medications are causing it or making it worse. And what it may be is that it's just a bad situation, and we're trying to help them using medications, but it's kind of just not enough. So I think we need to, again, try to make our thoughts and opinions based on fact and not just based on feelings. You have to ask yourself, what is your barrier? What is the thing that stops you from accepting the idea of psychiatric medication, right? And you have to, the main thing it comes back to is this idea of risk versus benefit. Risk versus benefit, okay? So say, for example, are you worried about what other people are going to think? Are you worried about the opinions of other people? So then you have to weigh the other people's opinions versus your internal suffering. Which one is more important? Relief from your suffering or other people's opinions, okay? If what's the barrier for you is privacy, can you use telehealth services? If the barrier for you is side effects, then you weigh risk versus benefit. What are the risks of the side effects versus what's the risk of the benefit? So my relief from my suffering versus the side effect risk. How dangerous are the side effects? How likely are the side effects? Are the side effects reversible? These are some of the things you have to think about when you consider treatment using psychiatric medication. Now, are you, when you are trying to make a decision about psychiatric medication, you meet with your doctor, I want you to think about three things. One is, I want you to look for a doctor that listens to you and allows you to have a voice. That's really important. If your doctor is not listening to you, not allowing you to have a voice, you're going to feel very uncomfortable with the idea of taking a medication. And for the doctors out there, I do want to talk to you for a second. Sometimes this kind of like thing about going straight to medications halfway through the appointment, it doesn't really work sometimes for Black patients, because what you're basically communicating is, I'm already starting to do decision making without you. Thank you very much. Let me choose for you what you want. It can erode trust. Okay, so you want to pay attention to the fact that it's really important to give your patients that voice and that kind of collaborative decision making, because you may not realize implicitly that you're talking over your patients and that you're making decisions for them rather than with them. So you need to really, really bear in mind that the healthcare system has a way of making Black patients feel very, very small. Okay, and if there's anything that we learned last week, Dr. Suzanne Moore, who died of COVID-19, she's a Black physician, a Black woman physician, and her role as a physician was not protective. It was not protective against racism in the healthcare industry. She was literally begging for proper treatments, proper pain control, proper medications. She was telling them, I don't think I should be discharged from the hospital. I still think I need treatment. She was basically just treated like another Black patient. And she spoke about how she tried to imagine if this is what Black folks are going through that are not physicians, they wouldn't even know that some of the ways that they're being mistreated. As a physician, she was able to pick it up, and she still died, guys. So if Black physicians are basically have no protection in some ways in our healthcare system, it's really important for the doctors out there that are listening that you need to really be aware of the factors related to racism in the healthcare industry and how it's literally killing Black people. Okay, so I'll get back off my soapbox. Okay, so the second thing with psychiatric medication is that you want to ask the doctor to explain how you can know if the medication is working or not working. Okay, so one of the confusing things about psychiatric medication is that sometimes you're taking it and you're just like, I don't even know if it's helping me. And why am I taking all these medications? And so it's really important before you leave that appointment that you have a good discussion with a doctor and ask them, can you give me the top 3 things to look for to know if this medication is working or not? How long will it take for me to see the benefit? How will I know? Because if your doctor can't explain to you why you're taking the medication or how it's supposed to help you, that's a problem. That's a problem. So they should be able to explain that to you. Okay. The third thing to look for with psychiatric medication is to ask yourself, what is your personal risk of decreasing or discontinuing medication? What's your personal risk of decreasing or discontinuing medication? Do you risk hospitalization or rehospitalization? Do you risk becoming psychotic? Like, what is your personal risk factor? Because if you have a high risk of something bad happening, you might want to slow down a little bit and take things much more gradually. Okay. Now, for those of you that were interested in alternatives to medication, we also had Dr. Monica Blight, who had called in from California back in the spring. And she spoke about kind of ways to think about holistic approaches to management of mental health. So that was a kind of a treat. So guys, that was number 8 on my top 15. So coming in at number 9 is The Power of Positivity with Dr. Onika Williams. The Power of Positivity. Dr. Onika Williams, she was an award-winning author and urological surgeon. She's written a children's book series called Dr. Adhd Dynamo. And that features a Black female protagonist character and promotes a message of collaborative problem solving and confidence. And she spoke about the 5 habits of positivity. The 5 habits of positivity. So I'm just going to recap the 5 habits of positivity from Dr. Onika Williams. One is, there is always a solution. You just have to work to find it. There's always a solution. Number 2, convert a limit into an opportunity. Convert a limit into an opportunity. So reframe challenges because the road to success is paved with failures. Number 3, keep the positives and discard the negatives. Keep the positives and discard the negatives, because so often we do the opposite. We kind of hold on to the negatives. And so here you kind of deal with the negative things, but you're going to carry the things that actually bring you joy and are ultimately uplifting. And number 4 is know that you are here for a purpose, and that is linked to caring for others. Know that you're here for a purpose and that it's linked to caring for others. You're wonderfully and uniquely made. Living a life that is not just about selfish pursuits fills you with that sense of worth. And number 5 is gratitude. Gratitude. Meditate on what you do have and what you're grateful for, because gratitude is healing. And Dr. Onika Williams also said that positivity is a process. It's not an endpoint. It's a process. Okay, so again, guys, you're listening to Black Mental Health Matters. I'm Dr. drkerryann Williams, and today I'm doing my top 15 recap of the year 2020. What were your favorite topics this year? Let me know. Drop me a comment on Facebook. Let me know what you want to hear about in 2021. So again, we're on streaming live on the Facebook page for 98.1 FM, The Urban Heat. You can also call in at 617-238-7111. Let me know. Looking at my Facebook scroll here, yes, Tamara said, it's very sad. What happened to Dr. Suzanne Moore? Incredibly sad. It kind of just makes you feel so kind of depressed about the healthcare system, really. But, you know, I really hope that things can get better in the future, that this kind of helps people to realize and do more training of their physicians. Okay, so coming in at number 10, juvenile justice. Guys, the school to prison pipeline is real and active. And often schools aren't able to adapt to the learning style of some of the students. And there's often poor communication between systems, poor continuum of care. Every provider sometimes even starts over because they don't have the prior records. And there are often misdiagnoses and labels. And young people often start to feel like they have very few choices. And programs like the JRI Smart CST offers direct support to families navigating issues of juvenile justice. And we had Janice Brownhill and Ed Powell from JRI on the show back in the spring. Guys, I really hope that we'll continue to advocate for our system to see our children in terms of their emotional and psychological needs, rather than as lawbreakers whose only option is punishment. I want the system to be able to hear us when we talk about the role of brain development and how this affects decision-making of children and young adults. Because a lot of times you're kind of basing somebody's decisions at age 40 on something on their record when they were a young adult, and their brain is completely different at that point. So Leon Smith, the executive director of CFJJ, Citizens for Juvenile Justice, came on the show, and he spoke also about school policing and how that perpetuates the school to prison pipeline by disproportionately affecting students of color, because then we literally have the police officers in the school. They're called school resource officers. They're literally in the school. And so that kind of leads to emotional disabilities being interpreted legally and met with legal consequences rather than appropriate mental health care, because police officers have police training. They're not therapists. So they're going to see things in terms of the law, and that's not necessarily appropriate for kids in a high school. So that's number 10. Number 11, autism in the Black community. This is one of my favorite topics. We don't really talk about autism much, but this summer, Beverly Ebay and Carmodali Galliot from the Black Mental Health Graduate Academy at William James College spoke about autism in the Black community. Autism is a developmental disorder that affects a person's ability to navigate the world socially. So they have trouble kind of making conversation, maintaining conversation, trouble with curiosity about other people's interests. They kind of tend to be very self-focused. But they can also have behaviors like rocking and jumping and flapping and yelling things out, and this can lead to some alienation. And so I'm hoping that maybe at least once a year I can have a talk on autism and just bring it to the forefront, because we have folks in our community that are really dealing with this. All right, coming in at number 12 is we had a special series with JRI in October. And within this series, Audrey Morrissey spoke about commercial sexual exploitation of our children. So that's sex trafficking. Yes, it is happening to children in our community. It is a multi-billion-dollar industry, and the primary buyers are usually upper-class white men. And My Life, My Choice is an organization that helps our young people find help and mentorship and can save them from this life. And then Larry Day and Viola Dean spoke about HIV and how the stigma of HIV is still very real and present in our community. And individuals with HIV often face social isolation and housing discrimination and all these wrong assumptions about transmission, and they have a higher risk of depression and suicidality. So the team at JRI Health provides social supports and other services. You can find them just by Googling JRI Health. Deborah Jackson spoke about trauma and the fight, flight, freeze, fawn response that we see in trauma, but we also see that response in children that are being punished. They try to fight back or run away or freeze up or kind of try to beg to you not to hit them, that sort of thing. We also see this response in grown Black men that are interacting with the police. They'll try to fight or run or freeze up or try to beg for mercy and that sort of thing. So trauma is all around us, guys. Then Aisha Barnes and Jonathan Regis spoke about homelessness, otherwise known as housing insecurity, in youth, and how to get youth connected to job training and CORE-friendly employment opportunities if they've been involved in the justice system. So coming up at number 13, spirituality and mental health. In November, the Reverend Willie Broderick II and Dr. Devin Cromartie Broderick spoke about the intersection of mental health and the Black church. And in September, Dr. Jessica Sneed called in from Arizona. She spoke about Christian counseling, which I personally feel could be a good option for many of us in the Black community, especially if your personal faith is really tightly intertwined with your worldview. It's not pastoral counseling. Pastoral counseling is going to be done by a pastor, and that's spiritual guidance. Christian counseling is traditional counseling, but they have training in how to do faith integration, and she spoke a little bit about that. Coming up at number 14, families. Families do matter, right? If you listen to the show that comes after mine, Larry Higginbottom, his show is called Families Do Matter. Family is the core of the community. Family therapy is one of the most effective interventions for an individual's mental health. And so in November, Liz Brenner and Marie Pierre Victor spoke about family therapy And the following week, our very own Marv Neal and X and Pat from 365 Dad spoke about fatherhood. And then finally, number 15, child discipline. Guys, over the last 2 weeks, I spoke to you about developing a discipline philosophy and thinking about what you want to teach your child about the consequences of misbehavior. There are alternatives to spanking, and you can teach your child skills that can reduce misbehavior in the long run and prepare them for adulthood, all while retaining your authority. You can retain your authority, but still convey warmth and empathy with your children, maintain that connection with them. So, guys, that's it for the show today. I want to thank you so much for listening in 2020. Thank you so much. And let me know what you want to hear about in 2021. I'm thinking about bringing someone on the show to talk about the COVID vaccine. So if you have questions about the vaccine and you would like for me to bring someone on to talk about that, let me know if you're interested about that. Just drop me a note on my Facebook page at drkerryann, drkerryann, Dr. Carryann, or a message on Instagram. And let me know if that's something you'd be interested in. And tune in next week, Sunday at 1 p.m. Eastern Standard Time for the first show of the year on 98.1 FM, The Urban Heat. Thank you for listening, and I'll talk to you next week.
Approximately half of people in Massachusetts with COVID-19 never feel sick but can still spread the virus.